Right, sorry for the delay if you have been waiting. Had some technological issues with phone and Facebook not wanting to connect. So here I am now in fantastic Brugmans Park. Yes, that's what it looks like when you go for a walk around here. So today I am going to be talking about toxic diabetes. Now, who am I? I'm Chris Pickard, Director of Body Imbalance. I help people get out of pain, but more than anything else, I love getting rid of toxins from people and showing people a better, cleaner way to live. Now, this month I've been really concentrating on diabetes because a couple of weeks ago it was Diabetes Awareness Week. And so we have a hello Monica, hello Jen, hello Brian. So this whole month I'm really focusing on diabetes for my patients, for my community, for people who want some extra help getting better from diabetes or just want to avoid it. Because the obesity and diabetes epidemic is skyrocketing, and it turns out that it's more than just the food and the calories we're eating. Now, a lot of people I see when I see them with diabetes, hello Rachel, hello Glenn, a lot of people there, I also try and detox them as well, because so many toxins cause a fatty liver, and the more fatty the liver is, the less able it is to actually store sugar, so it goes into your bloodstream, sends blood sugar up. And the recent program, the ITV, Fast Track Diabetes or Fast Fix Diabetes, they really did look at the liver rather than the pancreas, which is fantastic because it really does echo the sort of thing that I do. But I thought, I know that a number of years ago they found out that certain toxins were possibly related to increasing diabetes. So I thought, while I'm going to do a talk on toxic diabetes, why don't I have a look at what evidence has accumulated since I actually last looked at the direct link between diabetes and toxicity. And you know what? There has been research out there for at least 12 years that is just absolutely mind-blowing, and I cannot believe that I myself had missed this, but also it's absolutely shocking that no doctor is actually talking about this. And this is basically toxin-induced insulin resistance and just toxic diabetes. Because it turns out that there is a huge link, an absolutely huge link between toxins causing diabetes. First of all, there are a lot of toxins that are now called diabetogens, or diabetogens rather. Just like there are obesogens, toxins that we know increase obesity, we now know that there are toxins that increase diabetes. A lot of them, and they get lumped together scientifically as, a lot of these toxins that cause problems for us as persistent organic pollutants. So toxins, in other words, POPs for short. And a lot of these POPs are linked to diabetes. And the shocking thing is, back in 2006, they found that people with the highest levels of POPs in their blood and in their tissues were found to have 37.7 times more diabetes than people with low POPs. And it's estimated that between a third or maybe a half of diabetes is directly related not to how obese they are, but to how many toxins, how many POPs they've got in their system. In fact, they did a study looking at obesity and POPs and diabetes, and they found that the amount of diabetes was actually directly related to POPs, not to obesity. So if you were obese and you had low POPs, then it wasn't very likely you had diabetes. But if you had obesity and lots of toxicity, you had diabetes. But also, if you weren't obese and you had high toxicity, you were just as likely to have diabetes. So their argument was that it's not obesity we need to be looking at, it's toxicity. Now, of course, toxicity causes cancer, causes heart disease, causes obesity, causes diabetes. So you've got to clean up your act, you've got to clean up your liver. 37.7 times more diabetes in people with high persistent organic pollutants in their system. So what can you do? Where are these things coming from? Well, first of all, you've really got to remove the source of all of these chemicals. And so we're talking about pesticides, air pollution, all kinds of things. Some of this you can't do anything directly about, but you can indirectly. You can do things to clean up the air in your home. You can change the bathroom chemicals that you're using. Yes, because bathroom chemicals will be having a problem with this, or causing more problems. Then there's the pesticides and the herbicides on the food you are choosing to eat. You can eat more organic. You can do things to actually decrease the residue on these foods. You can grow your own as well. Now, along with just taking those simple suggestions, there's something else I'm going to talk about in a moment that coincidentally I got an email about this morning. But the other thing you need to do is actually remove the toxins from yourself. This is where things like Dr. Bob Rakowski's 7-day intense detox is so powerful, because it keeps on flushing the toxins from your liver, from your kidneys, from your body. And then the more you do it, the deeper it gets, the more you start flushing the toxins from the rest of your system. So, first of all, you've got toxins directly causing problems with diabetes, but then you've got toxins causing problems by actually causing the cell membranes to inflame, which means that they don't actually get the messages from the insulin. So not only have you got to remove all the toxins, you've then got to repair the cell membranes. You've got to restore the normal functions to them. So we have a 5-step approach to restoring your system to full function. It takes time, but it's doable, and it will help prevent all kinds of other health problems as you go along. So if you want help removing toxins from your body, please give us a call on 01707 662 704, or PM me or put a message below saying, I want help with toxicity. And we can get you on a program. Now, the other thing to help remove all toxins from your life is to actually know all of the things to look out for. And this morning I got an email saying that there's a Detox Your Home Summit, where lots of the world's experts on removing toxins from your life are getting together, and they're doing a whole load of webinars online. Starts very shortly, and then you can watch for free, and there's some free stuff, but then they're going to sell you the whole package for about $60 if you want to keep it. So I'll get a link to that and I'll put it in the comments, or in the actual in the comments, so that you can actually go and have a look at the Detox Your Home Summit, because there's some great things in there as well. Monica Nielsen, good question. How do you measure toxins in your body? Well, first of all, we know from the studies that have been done that we're all toxic, okay? And we will all do better by going through a detox. And there are various different nuances with the different types of detox, but I go through 2 different detoxes every single year, and I'm always doing minor detox as well. So the question isn't really about bothering to test for toxins, it's just detoxing. But there are tests to see pretty much how toxic you are that are simple, like the visual contrast sensitivity test, which is an eye test you can do right now online to see whether toxins have actually reached your nervous system. It also can help to see whether enough nutrition is reaching your nervous system. So it's a really useful, easy screening tool. And also what's been found is that you can do all these different kinds of tests, but sometimes they might not show up toxins. Also, actually testing for individual toxins can get incredibly expensive, because there are thousands to test for. And it's been found that a simple questionnaire, the QEESI survey, is actually just as good as actually doing hundreds and thousands of pounds of testing to see whether you probably are exposed to toxins. So you've got the questionnaire, and you've got the visual contrast sensitivity test, and then you also have what I use in the clinic, which is called the meta-oxy test, which is to look to see whether or not your cells are suffering with a lot of inflammation, because toxins often cause a lot of inflammation. So I look at these 3 tests, not separately, but together, looking at the clinical history. And also, I know that everyone's just going to do better with a detox. So, but the test can help us see whether you're actually getting better even if your symptoms aren't. So I hope that's been of great help. Please, if you know someone with diabetes, especially if they're normal weight and they're exercising but they still got diabetes, it's probably because they're toxic. Okay? And we put people through a detox, we change their diet, we get them exercising, we get them healthy again. So please spread this video around to everyone you know, because we've got to stop diabetes and we've got to start telling everyone about this hidden cause, because it is a killer. Thank you very much for watching, and remember you can go to my website bodyimbalanceuk.com, and also please request to join the Health Lab, because this is where we put all of the replays. Be well and live long and prosper in a toxic-free environment.